Hi, everyone. Thank you so much for joining us. My name is Dr. Adam Chrisman. I'm the Chief Veterinary Officer with DVM 360. Today, we're going to be speaking about a topic that's very relevant with us today. It's about COVID-19 and how it affects the veterinary professional team, as well as the patients and the medical professional staff as well. Joining me today is Dr. Scott Weiss. Dr. Scott Weiss is a veterinary internist and microbiologist and a diplomat of the American College of Veterinary Internal Medicine. He is a professor at the Ontario Veterinary College, University of Guelph, and a zoonotic disease public health microbiologist at the University of Guelph Center for Public Health and Zoonoses. He is also Chief of Infection Control at the Ontario Veterinary College Teaching Hospital and holds a Canada Research Chair in Zoonotic Diseases. Thank you, Scott, so much for joining us today.
Hey, thanks for having me.
Also with us is Dr. Beth Davidow. Dr. Davidow is a clinical assistant professor of emergency and critical care at Washington State University. She is also president-elect of ACV-ECC, the American College of Veterinary and Emergency Critical Care, and a consultant for VIN. She has previously owned several multi-specialty hospitals and an animal blood bank in Seattle. She has a certificate in patient safety and quality from the Institute for Healthcare Improvement and currently blogs on issues of ownership, quality, community, and sustainability at vetidealist.com. Thank you so much, Beth, for joining us as well.
Thank you for having me.
Absolutely. So let's get right into this module. We're going to be speaking a lot about COVID-19 and how it affects the veterinary community in this one. And I want to start with you, Dr. Weiss. Let's first start talking about what is COVID-19? Can you shed a little bit of light on a basic of what it is and how it got here?
Well, I think we've all had a pretty big crash course in coronaviruses over the last few months, so everyone's got a little basic on that. The keynotes, I guess, for us on the veterinary side is this is a coronavirus closely related to SARS that emerged in China in December, maybe a little bit earlier than that. So originated in a bat, as far as we know, maybe came through an intermediate mammal host, but then settled on people. And as you know, it's spread widely across the world and causing the disease that we call COVID-19. One of the big questions we have on the animal side is this now a purely human disease or is it a predominantly human disease? No doubt this is almost all human-human transmission. But from a veterinary context, we have to think about, is there potential for our patients to get infected, which is something we need to deal with in an infection control standpoint? Is there a potential for our patients to get their hair coats contaminated and act as a fomite or a mechanical vector? And then the broader issue is just how do we work in veterinary medicine while social distancing? How do we work in an era while we're running out of supplies because those are getting diverted, obviously, to the human healthcare system? So it's bringing in a lot of issues that pertain to medicine, basic infection control, and things we hadn't thought about maintaining a vet clinic.
Yeah, absolutely. It definitely has turned the way in which we practice veterinary medicine upside down. Beth, how has COVID-19 affected the way you practice?
Well, so it's affected me in a couple of ways. So as a professor at the veterinary school, most of the veterinary colleges have sent all their students home to try to minimize the amount of infection and try to maximize social distancing. That means that the first, second, and third year students are now learning online. And the fourth year students, many of them are missing clinical rotations and trying to learn as much as they possibly can before becoming veterinarians also online. In the Seattle area, we were one of the first hit by this virus. We had one of the first cases in the United States. And the veterinarians in this area have been adopting curbside check-in. And also with the governor's order, almost everybody has switched now to doing only essential care, which means no elective procedures. So it's a huge change for the way we practice medicine in this area.
Mm-hmm.
Maybe I'll ask Beth a question there. So the question of essential versus elective is really a big one, right? So in Ontario, they just said, okay, essential services only, and veterinary medicine is included in that with not a lot of guidance. I've seen some states with very rigorous things saying, okay, these are the types of things that are elective and essential. Has Washington, have they said anything in detail? Because I think we can take this whole elective essential thing down a lot of different roads and not get the same answer each time.
Yeah, I think it's a super complicated question. And I think if you asked every veterinarian, people would have very different answers. In the Seattle area, it's basically said anything where you're using PPE, you should be trying to minimize as much as possible. but there hasn't been a ton of guidance yet on very specifics. The questions become, what if you have a pet who has cancer, who needs chemotherapy? You're using PPE to treat those animals. I think many of us would say that's essential, but what if that pet has a very low likelihood of survival? What should we be doing in that situation? I think vaccines are another really tricky thing to answer. Certainly, I think all of us want any pet who hasn't had a rabies vaccine, getting a rabies vaccine. Almost everyone is considered essential. But what about parvovirus vaccines for young puppies? Certainly having a parvo outbreak or a kennel cough outbreak in the middle of a coronavirus outbreak doesn't sound very fun to me.
Yeah,
So it's super tricky.
Like some of them are easy, right? Like heart, abdomen.
right.
So I think some of these are kind of easy, right? The hip bicara, the hemoabdomen,
Yep.
we need to treat those. The cancer therapies are ones, once they're, new cancer therapies are in the middle of a therapy, like painful disorders get kind of gray. So we got an animal that needs a TPLO. Should we maintain it on an NSAID? What's the good and bad point? And that's really case by case. And then the one thing that we're really trying to emphasize that gets missed is the human animal bond component here. Like people are stressed, right? People are freaking out. They're stressed. They're confined to their homes. Sometimes the pet is the lifeline, and we need to make sure that we're not compounding that stress by saying, okay, well, we can't take care of your animal right now because you're locked away. So
Right.
we have to be aware of that too, as we don't want unnecessary animal welfare issues. We don't want human welfare issues. So it's really challenging. It's coming down to really case by case definitions. We need to make sure, I think as a profession, we're showing we're socially responsible, saving PPE, like you said, helping with the social distancing, but also trying to maximize what we do. And that's tough.
I think one of the things that is also really tough is that on the human side, it's very hard to know what to do. And so talking to a veterinarian in New York last night, the orders on what was essential and what wasn't changed multiple times in a 48-hour period. And that makes it really tricky to practice because you have to really be paying attention to what people are saying. And so I think this is a definitely complicated issue. And certainly I do absolutely agree with you that our pets really are essential to our well-being, and trying to make it both as easy as possible for people to get care for their pets, but also minimizing contact between all of us is super important.
I agree. It boils down to that human animal bond, and it's testing that bond more so than ever right now, and it's trying to find that balance essentially of what's essential versus non-essential. And if the human's life gets compromised in the face of an animal, where is that gray zone essentially? And that's what makes it tough. Beth, I wanted to ask you this too, because there's obviously a crisis with ventilators. Can you share us a little bit of light of that wonderful piece of information that you helped create for the rest of the profession?
Yeah, so one of the discussions we started having as the College of Veterinary Emergency Critical Care is that we do have life support ventilators in our facilities to treat animals who have things like pneumonia or smoke inhalation or damage to their lungs from a trauma. But we don't use those as often as they're using them in the human side, and so they're mostly available. As we started talking as a group, we realized that some people had already been in contact with human hospitals to let them know that we had those available, but it hadn't been kind of nationwide. It had been very kind of point to point. And so we made the decision to try to set up a nationwide database, and we just did this using a Google form, which then feeds into a Google spreadsheet. And we then shared that spreadsheet with the Society for Critical Care Medicine, the American Hospital Association, and the American Medical Association on the human side, so that they could share it out and let people know, hey, here's veterinary hospitals who have these, here's how you contact them if you need them. There's about 180 hospitals who have ventilators listed on the list. Most of us only have one or two of these machines, so not a lot. I now know of at least 40 hospitals who promised their ventilators to a human facility, and I know of at least 6 facilities who've actually either given their ventilator up to a human facility or know that it's actually already in use, especially in the New Jersey and New York area.
I can personally attest to that because I know that one of the hospitals locally here, North Star Vets, they donated their ventilator to Robert Wood Johnson in need of 6 children that actually needed to be put on the ventilator. So because of that piece of information, look how wonderfully, in a good way, we were able to help the human side out. So that's fantastic. Both of you guys, so, talk to me a little bit about the community that you guys live in. How is the veterinary community coming together in times like this?
So in Canada, our veterinary community is actually fairly small. We're a big country, but a small population. And we have a fairly good community that communicates fairly well. And from the very start, there's been a lot of discussion on how we maintain veterinary care, but do it while being socially responsible. And a lot of that was, like Beth said at the start, curbside admissions. Those got brought in fairly early. We found in a little bit of survey that's been done, most clinics are doing multiple measures to reduce social contact. So, having fewer contacts with owners, having fewer contacts in clinics, trying to do things to minimize any hand contact points. So paperwork and pens, bringing in telemedicine. Our regulator has been very good saying, okay, these are different times. We don't really set standards. We have expectations. So if we get into issues with PPE shortages or verbal consent, we have to document verbal consent, but we don't need everyone to sign everything. So I think our different groups are all coming together and figuring out, okay, how do we maintain the best animal care we can in this new normal, at least the temporary new normal?
Yeah.
Yeah, I think one of the things that's been really interesting is looking at how communities are forming in different ways to support each other. I think VIN has become a really good resource. They put out a bunch of COVID-19 information, both for how to work in clinics, and then they're working very hard to make sure that businesses have the information they need to stay viable during this incredibly challenging time. The veterinary colleges have all been in lots of communication about trying to do the right thing for their students. And then on the local level, I think this is where our state associations have really proven how valuable they are and how important they are. The Washington State Veterinary Medical Association has been great about getting local resources out to us and trying to make sure we have the information we need about how do we get fast loans, what kind of programs is the governor putting out to help businesses. And so those different communities have all been really important to support each other.
And I think we have people searching for information too, which is good. They're thinking about ideas, thinking about problems, and everyone's talking and asking. We've been putting out information on our blog about social distancing and elective and essential procedures and how to admit animals, personal protective equipment, things like that, based on all the discussion that's coming up. So I think we've got various people coming together to come up with ideas, and we're winging it, right? We don't have data. It's a virus we've known for 3 months. And from the animal side, we know almost nothing, but we're taking the standpoint, okay, we need to be proactive. We don't need proof of a problem before we start bringing in some solutions. And I think everyone's a lot more proactive than we probably would have been 5 or 10 years ago. I think we keep learning as we go through these episodes.
One of the things I'll share with you too, I'm on the board for the NJVMA, and because it's such a dynamic thing, it changes so quickly, we've been doing these Facebook Live events just to get engagement within the local level, just about labor laws and employment opportunities and what's happening with what we need for our PPE. And just like you were saying, Beth, too, like it does change. And I feel like just staying on top of that and being consistent within the community has been a good nidus of communication on the local level, at least for the veterinarians and the support team. I want to ask you, Dr. Weiss, this question. What are your thoughts on the recent announcement that feline antiviral drug for FELV and feline infectious peritonitis is now being tested against COVID-19?
Am I okay now?
Yeah.
Okay. Yeah, so there are various drugs that are being tested for this disease, and everyone's pulling out all the anti-coronavirus drugs they can find. There's been one that's been used in cats pretty much on the black market for a while with a lot of potential for the treatment of FIP. And the problem is that it hasn't been available commercially because the manufacturer has a very similar drug that they've been getting licensed for Ebola. So people have had to source this through questionable channels and black market sources. Now, the human drug, remdesivir, has been used in people. There's some trials going on with some, moderate success, it sounds like, from us on the animal side, this may ultimately help us, because if we get a licensed drug for this product that's out there in humans, we might have a licensed product that we can use off label in animals. We're going to learn a lot more about coronavirus drugs because of this disease. And ultimately, we'll hopefully be able to take some of that and apply that to coronavirus diseases we see in animals, and particularly FIP.
Oh, nice. Beth, anything you want to add?
He knows a lot more about this stuff than I do. So.
No, that's good.